Power to Truth with me, JJ Tabane. On Mondays, we do a debate or a roundtable. Today, we're informing ourselves about the coronavirus and all of its intricacies. And one of the things I want to explore now is the whole vaccination issue. That's all that's on our minds, isn't it? Are we ready for the vaccine? Is this vaccine going to be a panacea of dealing with the virus or not? But more importantly, the big question, why is it not being produced here? We've got CSIR, we've got all of this Medical Research Council, we've got top universities, some of the world-class universities, I mean, VETS, UCT, University of Pretoria, Stellenbosch, you name it, with big scientists with big titles. Why are they not producing this vaccine here? Mr. Msibi, let me come to you on this. Lead us in this. In the first place, the vaccine plan, are you convinced, where you are sitting, I'm sure you've got access to all of these politicians and the scientists, you can be able to give me an informed decision. You know, are you convinced that we know what we are doing around the vaccine issue, number one? Number two, why are we not producing it here?
JJ, just there's a couple of things that I'll just mention here. You mentioned academic institutions and the CSIR. We've been doing some work with the CSIR from the month of March on prophylaxis and on a treatment for COVID. Yeah. And that work is now complete. We're going for efficacy test. We've appointed the University of Colorado in the US to do the final leg of the work for us. And we are starting the next stage of our COVID strategy, which is South African vaccines, right? And we've already signed with the CSIR a first agreement on the development of a South African vaccine, right? And I think for me, it begins to talk into our definition of indigenous knowledge and also solutions for Africans. And often there's two sides to it. The one side is whether by that we mean what is being used and prescribed by a herbalist exclusively, or do we also include what our children and citizens that have been educated in this country in the Western sciences, that when they use the Western sciences to develop solutions, do we consider that as African solutions? Yeah. And I just want to also comment on the indigenous side, right? That I think we're being unfair to ourselves, and also we risk discrediting African indigenous practices, in that for as long as you and me have been alive to a large extent, and I'm generalizing here, right? Yeah. We have invested in African indigenous medicines, and it can't be that those practices which at the time that they were demonized were actually ahead of Western medicine in terms of understanding viruses and bacteria and fungi. And ever since then, there has not been any advancement. That it is only us who have not invested in the development of our African indigenous medicines, and suddenly we expect that they will come to the rescue on COVID. When we have TB, we have malaria, we have HIV, we've never said we should be investing in the African traditional medicines. Yeah. China, when I was in China, I saw two universities of Chinese traditional medicine. We don't have that in South Africa, right? So whilst there are a whole lot of practices that are helping people, and the evidence is anecdotal, some people get assistance, others end up in a hospital, and others end up losing their lives as a result of not getting immediate attention in a hospital, or even being failed by the system, because we don't have necessarily an antiviral that has been administered, in particular in public hospitals. The private hospitals are using remdesivir, the majority of them. Right? The public hospitals are not using remdesivir, and it will be interesting to see the performance of the public versus private in terms of the mortality rates.
And the recovery rate,
Yes, but my point here is that we need to invest in our herbal medicine, in our traditional medicine, because there's a lot of cases where Western pharmaceutical companies have taken those herbs and they have actually created the right concentration. Because I mean, if you pick up a plant from your garden, you don't know what the concentration is. And in terms of the dosage, the frequency you must use it at, the temperature you must use it at, all of those factors need to be studied and develop the science and bring it, because it can't be trapped in time. At the moment, it is trapped in time. It is as it was as practiced by our forefathers.
Yes.
But that is different today, and it has to catch up, and we must invest in it, as opposed to suddenly wake up one day and expect that it will have miracles. But even then, we don't have a coherent knowledge of it to say, this is how you do it. But there are also other practices like steaming, which I do believe that the Department of Health needs to make a statement. Because when steaming, as long as it doesn't hurt you, it may be the way to go. But I think being quiet about these practices does not help our people.
Yeah, Prof, I mean, that's a clear criticism there about how we've structured our research agenda in the country. What's your response to that? I mean, is there a section within the Medical Research Council where you are looking at these indigenous knowledge systems and how these can be infused into the pharmaceutical solutions that are considered to be Western?
Yeah, sure. It's certainly an interesting discussion, and I certainly agree with my panelist because if you look at indigenous knowledge system in general, it has been neglected in terms of funding, and funding is actually at the core of driving the science agenda. Maybe if I can just give you an example, without diverting too much, we talk about vaccines. Does South Africa has got the capability and the capacity to produce its own vaccine? The answer is yes, but why? It's because of the funding. Because if you do partial funding to research agenda, obviously researchers will not have enough money, to do what they need to do from the beginning to the end. So the end-to-end kind of a research has to be well funded, and it has to be deliberate. So I certainly agree that if we need to move the scientific agenda in the country, whether it's about Western science or indigenous knowledge system, we just need to do enough funding.
Yeah, but where you are sitting, and given that we have had a pandemic now for months on end, the entire world has been on a race to find a vaccine. Do you think, if you were to talk to me frankly, that we have reorganized our funding priorities in order to result in a possible vaccine?
We have responded as the South African Medical Research Council right at the beginning, at the outset of the pandemic, to really give researchers money to do all kinds of things, epidemiology, prevention, research, and even research towards vaccine, clinical development. So we have funded the whole lot of research projects towards the pandemic, and obviously we don't have enough money to fund everybody, and we don't have enough money to fund huge projects that require a lot of funding.
Yeah, but where you are sitting, what can you tell us? I mean, is it possible to get a South African vaccine on time? Or is it something that's going to come when it no longer matters?
At this stage, when we are in the middle of the pandemic, trying to do our own vaccine, that will be great. However, by the time the vaccine is ready and we are able to manufacture this vaccine, it will just be a little bit late. Maybe not too late, but it will be a little bit late to have any impact on the pandemic.
I want to interrogate that a little bit more after the break, because it looks like Mr. Msibi over there is saying, together with the CSIR, they are working on a vaccine. So I want to understand whether or not that's going to come when it's no longer needed and it's academic, or is something that will form part of vaccinating the 67% of our population. We're having a conversation now with our panelists over there about the coronavirus and talking about vaccines. After the break, we interrogate further. Does South Africa have a clear plan? Are my panelists convinced that this plan will get us vaccinating 67% of the population as it is planned on time? Stay tuned for more after the break.